stem cells, a lot have been said by Professor Fridon in the previous lecture. I will go through it briefly. These are, I would say, blend cells, which has the ability to go two type of cell division. One is the typical, where they produce two daughter cells, and potentially they can go through unlimited replications to produce daughter cells. And then under certain physiological conditions, they go through atypical cell division, where they divide into a daughter cell and into a, give rise to a lipid which binds to a free cell, and then progenitors and all those specialized cells. So typical and atypical. Types जो हैं दो तरह से हम इसको कर सकते हैं, differentiation potential and origin. अगर हम origin की बात करें, the first cell जब sperm और ovum मिलते हैं, is totally potent. It can produce both placenta and fetus. Once fetus has been produced, जो cells हैं वो placenta produce नहीं करेंगे, but the whole human genome, it is called the pluripotent stem cell. The embryonic जिनकी हम stem cell की बात करते हैं, this is the blastocyst stage or the inner mass जो है, all these cells are the pluripotent cells. Then multipotent cells, जितने हमें adult stem cells मिलते हैं, वो adipose derived हैं, bone marrow है, all those, they are multipotent. जब वो further differentiate करते हैं, then उनकी जो differentiation potential कम हो जाती है to a specific layer, तो then we call them oligopotent. और जब वो then we call them unipotent, कि वो एक ही तरह का produce कर सकते हैं, उससे ज़्यादा नहीं. Right? Or then embryonic umbilical cord derived stem cells and adult stem cells. I will be talking only about the adult stem cells. तीन major sources हैं. ठीक है? Oldest and most commonly used word over is bone marrow concentrate. हम iliac crest से या tibial tuberosity से bone marrow लेते हैं, उसको process करते हैं, and then we use it accordingly. Adipose derived is stromal vascular fraction. It's a cocktail of different so-called stem cells or stimulatory cells and progenitor, adipocytes, all those things. And then thirdly, peripheral blood derived, very small embryonic-like stem cells. Right? They have specific, ये जो four properties are very important. Self-renewal and potency. They can self-renew themselves and can maintain their potency. Then lineage, specific lineage, multi-drug resistance, that these stem cells possess ATP binding cassettes, which has the ability to secrete different particles or different compounds out of the cell. So this capacity can be used to test different multi-drug resistance and all those things. And finally, plasticity and transdifferentiation studies have shown that cells from one lineage, if we talk of mesenchymal stem cells, under specific conditions, they can transdifferentiate into other type of cells coming from ectoderm or endoderm. Right? So what does bone marrow or concentrate contains? It contains hematopoietic stem cells. The count is 1 to 10, 1 per 10 to 15,000 cells. This is the major product we get in bone marrow concentrate. Then mesenchymal stem cell, this is 1 per 250,000 stem cells. Then we get adult and precursor T and B cells are immune cells. Then white cells, concentrated platelets with all the growth factors, scaffolding proteins including fibrinogen, fibrinectin, alpha-2 macroglobulin, anti-inflammatory cytokines, especially IL-1 beta 6 and 8, then BMP2 and 7. So beautiful cocktail for regeneration, right? And very easy to be done, right? So bone marrow concentrate, again, it gives rise to blood cells. Mesenchymal stem cell can differentiate into fibroblasts, osteoblasts, osteocytes, adipocytes, chondrocytes. So jitni aapki MSK ki conditions hain, we can treat them better with SVF, this bone marrow concentrate. Then hematopoietic stem cells upregulate cytokine release and stimulate stem cells to promote regeneration, right? So not only the cells, also the extracellular matrix I was talking about, right? Then bone marrow aspirated concentrate is considered minimally cellular manipulation क्योंकि आगे हम आएंगे SVF में, तो we have to use certain enzymes collagenase 1, इसमें किसी किस्म की manipulation नहीं है. So this is most widely done in USA क्योंकि FDA इसको उस सारे पैरामीटर्स जो हैं तो उस पर ये फुलफिल करता है. Then BMAC contains mixed cell population which is believed to enhance the performance of mesenchymal stem cell जो आपका workhorse है body का. If we talk of adipose derived stem cell, this is enzymatic based digestion based process. You harvest the adipose tissue, उसको आप digest और वो करते हैं for some time with collagenase, then centrifugation और जो product आपको मिलता है that is the stromal vascular fraction pellet, or that contains all those things which are done. So, but in USA this is still not approved by FDA because of the enzymatic digestion. But here fortunately जो हमारी regulatory bodies हैं, we are working with them, इस पे कोई problem नहीं है. Right, I would like to focus on this a bit. कि very small embryonic-like stem cells represent a population of extremely small non-hematopoietic pluripotent cells that are negative for lineage markers and express SCA1 in mice and CD133 in human. So they are not hematopoietic, non-hematopoietic mononuclear cells. Their embryonic-like characteristics include expression of markers for pluripotency, the ability to give rise to cellular derivatives from all three germ layers. So they are as good as the embryonic stem cells. Right? This is the proposed hypothesis from primordial germ cells through some that very small embryonic-like stem cell is produced, which through an intermediate in angioblast can produce hematopoietic stem cells, endothelial progenitor cells, and mesenchymal stem cells, and tissue-specific stem cells. Right? How this procedure is done? The concentration in peripheral blood is as low as कि अगर हम बगैर stimulate किए इसको harvest करेंगे तो हमें जो count मिलता है that is very less. For that, what we do is कि filgrastim जो है, that is a colony stimulating factor, is commonly used after chemotherapy or before chemotherapy कि ये mononuclear cells को bone marrow से peripheral blood में mobilize करता है. We give 1 ml for 4 days subcutaneously, and then on 5th and 6th day when the number is in around from 0.6 to 30 per microliter, then we do the procedure. Procedure is very simple. We use this multi-component system. It contains this kit जिसमें हमें बफी कोड भी मिलता है और जो हमें मोनोन्यूक्लियर सेल जो हैं वो सारे मिलते हैं. Right? This is an outpatient, just simply 16 gauge cannula से IV line लेते हैं और आप ACDA अटैच करते हैं ताकि जो ब्लड आ रहा हो उसके साथ मिक्स और वो कैगुलेट ना करे. और इस मशीन के अंदर देयर इज़ दिस लैथम बॉल जो इसको सेंट्रीफ्यूज करता है और जो वाइट सेल लेयर है उसके अंदर हमें मोनोन्यूक्लियर सेल्स जो है वो मिलते हैं. राइट? और this was the first publication way back in 2012 and the study proved that human very small embryonic-like stem cells are able to generate human bone tissue in a mouse model for skeletal repair. So not only bone, it can be used for other conditions as well. Right? So again, different studies for chronic back pain, systematic reviews, so huge evidence both systematically, pain scores, Osworthy, on numerical scale, Euro quality of life. So there is good evidence published. This is one of our own papers published on diabetes, type 2 diabetes, using peripheral blood derived case series of 3 patients, all the parameters, HbA1c, insulin dependence, oral, everything improved. Right? So just about the acellular therapies, exosomes, I will be skipping this as Dr. Fridon has 2 full-fledged lectures on this, But these are small nanoparticles ranging from 30 to 100 or 30 to 150 nanometers, which are phospholipid-rich membrane and excreted. This is how it is formed, and it excreted. This is important in intercellular communication and has a huge regenerative potential. Right? Again, published evidence for exosomes. So now coming to evolving applications. If we talk starting from degenerative diseases like osteoarthritis, degenerative disc disease, autoimmune diseases, rheumatoid arthritis, अगर हम ऑफ्थेल्मोलॉजी की बात करें, मैकुलर डिजनरेशन, रेटिनाइटिस पिगमेंटोसा, ऑप्टिक नर्व एट्रोफी, स्पोर्ट्स इंजरीज, growth of damaged tissues and organs, skin, bladder, liver, kidney, pancreas. Just 2 minutes, right? So burns, craniofacial plastic surgeries, Parkinson's disease, all those things. These are few of the patients we have worked with. This you can see fracture of C7 spinous process. This patient presented to us almost 9 months after the injury. It was a non-healing fracture. We did peripheral blood-derived local and systemic, and this is pre-treatment scan, this is post-treatment. This is pre-treatment, this is post-treatment. Right, this is another patient with huge disc, and this patient developed cauda equina, loss of ball and bladder. We did nucleoplasty followed by intradiscal stem cell, and you can see all those disc hydration improve, and patient now is walking comfortably. This is knee joint. This is on MRI. You can see the thickness, increased thickness of cartilage as compared to the pre-treatment. Right? This is one of my patients, a young doctor, fresh graduate BDS with RA, totally destroyed right hip. We did 2 PRP sessions and 1 session of adipose-derived stem cell, intra-articular and systemic. And after treatment, 6 months, you can see whole the joint space has come back. And young doctor, she got married and has given birth to a beautiful daughter. This is another osteoarthritic knee. Post-treatment, you can see the increase in the joint space. Right? This is the procedure we do intra-articular, plus we do periosteal in the intraosseous injections. Right? This is our study which we are doing in combination with Ophthalmic Society of Pakistan. Dr. Irfan Kramat will be sharing this in the afternoon. We are working on retinitis pigmentosa. We do 2 sessions of PRP followed by 1 session of peripheral blood-derived, both systemic and through subtenon or suprachoroidal route. And you can see just from counting fingers to 618, 624, lots of improvement in majority of the patients. Right? This is again you can see lot more areas of the in this field. Dr. Sarfraz can appreciate this. So then increased thickness from 104 to 202 in Stargardt disease, which was otherwise could not be even thought of. Right? This is that patient with gangrenous finger. You can see how bad the gangrene was, right? And this is just PRP and photobiomodulation. And and you can see even nail got back and all the function was restored. Right? I worked with disabled CP kids, flaccid CP, 3 to 4 months, and now this child is going to university, alhamdulillah. Right? Another spastic CP in 6 months was walking, and again now going to school. Right? Left-sided weakness, you can see the difference between the 2 sides. Left side is so weakness. Same child in 3 months' time is putting weight on this affected limb and walking. Right? Corticovisual blindness, remarkable improvements on all those things. Hair growth, this is yours, right? Now, what is the way forward? I will be needing just 2 minutes, right? So, if we talk of पाकिस्तान, 3 रेगुलेटरी बॉडीज़ जो हैं वो हमारे साथ कंसर्न हैं. मोस्ट इम्पॉर्टेंट इज़ पाकिस्तान मेडिकल डेंटल काउंसिल, CPSP डेफिनेटली एकेडमिक क्रेडेंशियल्स के लिए, एंड पंजाब हेल्थ केयर कमीशन फॉर ऑल दी रेगुलेटरी एस्पेक्ट्स. Just before Ramzan, Professor Freedon, Dr. Sabah, Dr. Bushra, myself, Dr. Tania we had 2 meetings with them, और वहाँ पे लास्ट मीटिंग में उनके रजिस्ट्रार भी थे PMDC के, और सर्जन थे जो उनके सर्जरी एंड लाइट के हैं राही साहब, वो भी थे. तो वी हैड अ वेरी फ्रूटफुल डिस्कशन एंड केम अप विद सर्टन प्रपोजल्स कि जो टीम है, जो अभी तक कंसेंसस है हमारा, कि जो टीम है वो कंप्राइज होनी चाहिए कि जो बंदा कर रहा है उसको अपनी फील्ड में पोस्ट ग्रेजुएशन उसकी होनी चाहिए. वन थिंग सिंपल, जो ग्रेजुएट है दे शुड नॉट बी राइट. देन सेकंड पार्ट जो उतना ही इम्पॉर्टेंट है कि जो आपकी रिसर्च साइंटिस्ट की टीम है, there has to be PhD or additional postdoctorate with, as Professor Freedon very rightfully said, with proper experience and expertise in human regenerative medicine, right? So ये तो आपकी टीम है, along with जो आपको लेबॉर्ट्री फैसिलिटी चाहिए उसकी भी रिकमेंडेशन उन्होंने मांगी थी, हमने उनको दे दी हैं कि जी उसकी ये प्रॉपर स्पेसिफिकेशन हैं. दिस इज़ एवरीवेयर ऑन गूगल और लॉट्स ऑफ रेफरेंसेस कि जी लैमिनर फ्लो होना चाहिए, बायोसेफ्टी लेवल 2 कैबिनेट्स होनी चाहिए, प्रॉपर एक सिस्टम. कंसर्न ये होता है कि जी आपकी स्टेरिलिटी मेंटेन रहे और कोई किसी किस्म की इन्फेक्शन या कोई और कॉम्प्लिकेशन ना हो सके, राइट. देन एकेडमिक के लिए the people from University of Health Sciences, they will be proposing a 2-year training program that would be 4 semester based. और इनिशियली हमने उनको रिक्वेस्ट ये किया है कि जी जो हमारा फर्स्ट सेमेस्टर होगा जब वो क्लिनिशियंस कर लें तो आप फॉर अ विंडो ऑफ 3 to 4 years और मे बी वी कैन एक्सटेंड इट टू 5 years उसको करने दें. बाकी उस दौरान में जो बाकी ट्रेनिंग है वो भी कर लेंगे. प्रॉब्लम इज़ कि जी अगर इससे छोटा बात करते हैं तो PMDC या वो जितने हैं वो 1 साल के प्रोग्राम या 6 month सर्टिफिकेशन को एज ए स्पेशलिटी एक्सेप्ट नहीं करते. तो सो वी नो कि वी ऑल आर बिजी क्लिनिशियन, तो सो वी विल गेट टाइम इंशाल्लाह फ्रॉम देम अ विंडो ऑफ अराउंड 4 to 5 years कि जिसमें हम इसको अपनी क्वालिफिकेशंस को इम्प्रूव करें ताकि इसको एज ए स्पेशलिटी डेवलप करें और क्वैकरी ना आए, एथिकली हम पेशेंट्स को बेनिफिट दे सकें. We all need to learn from others, from our own mistakes and experience, integrate all possible modalities with good and promising evidence to treat different conditions, because as a Muslim we firmly believe there is no disease for which Allah Almighty has not provided us cure. We simply have to discover it. Thank you so very much.